Hi everyone, welcome to our channel, Canadian Nurse Expert. In this video, we'll go through 10 high-yield NCLEX-style questions with detailed explanations on the topic glucose and hormone regulation. A patient is admitted with suspected syndrome of inappropriate antidiuretic hormone, or SIADH. Which finding would the nurse expect? Options are A. Polyuria and dehydration. B. Hyponatremia and low serum osmolality. C. Hyperkalemia and metabolic acidosis. D. Hypernatremia and increased urine output. The correct answer is B. Hyponatremia and low serum osmolality. SIADH causes excessive ADH secretion, leading to water retention and dilutional hyponatremia, which lowers serum osmolality. Question number 2. The nurse is caring for a patient with diabetes insipidus. Which assessment finding requires immediate intervention? Your options are A. Urine, specific gravity of 1.002 B, serum sodium level of 155 milliequivalent liter C, reports of excessive thirst D, urine output of 3000 ml in 24 hours. The correct answer is B. Serum sodium level of 155 milliequivalent liter. A sodium level above 145 milliequivalent liter indicates hypernatremia, which can cause neurological symptoms like seizures. A patient with type 1 diabetes mellitus is experiencing shakiness, sweating, and irritability. What should the nurse do first? Options are A. Administer insulin. B. Give a snack with protein and fat. C. Check blood glucose levels. D. Encourage fluid intake. The correct answer is C. Check blood glucose levels. Hypoglycemia symptoms must be confirmed with a blood glucose check before administering treatment. Alright, here we go with question 4. A nurse is providing discharge instructions for a patient with Addison's disease. Which statement indicates a need for further teaching? A. I will take my hydrocortisone every morning. B. I need to carry an emergency kit with injectable hydrocortisone. C. I should increase my medication dose when I'm stressed. D. I will stop taking my steroid medication once I feel better. Correct answer, D. I will stop taking my steroid medication once I feel better. Now let us break it down. Patients with Addison's disease require lifelong steroid replacement therapy. Abruptly stopping steroids can cause an adrenal crisis, which is life-threatening. Moving on to question 5, a nurse is monitoring a patient with Cushing's syndrome. Which clinical manifestation should the nurse expect? GAP 1 S. Options are A. Hypoglycemia. B. Hyperpigmentation. C. Hypotension. D. Moon face and truncal obesity. Correct answer, D. Moon face and truncal obesity. Here's why. Cushing's syndrome results from excess cortisol, causing characteristic features like moon face, buffalo hump, truncal obesity, and thin extremities due to protein catabolism. Now we have question 6. A nurse is assessing a patient who has been prescribed desmopressin, DDAVP, for central diabetes insipidus. Which finding indicates a therapeutic response? A. Increased urine output. B. Decreased thirst and normal sodium levels. C. Increased serum osmolality. D. Increased blood pressure and hypokalemia. Think it over for a bit. The correct answer is B. Decreased thirst and normal sodium levels. Let's go through the explanation. Desmopressin, DDAVP, replaces antidiuretic hormone, ADH, and helps the kidneys retain water, reducing thirst and stabilizing sodium levels. Alright, let's move on to question 7. A nurse is caring for a patient with severe syndrome of inappropriate antidiuretic hormone secretion and a sodium level of 118 milliequivalent liter. Which intervention should the nurse anticipate? A. Administering isotonic IV fluids. B. Restricting fluids and administering hypertonic saline cautiously. C. Encouraging the patient to drink more fluids. D. Administering rapid diuretics to increase urine output. Correct answer, B. Restricting fluids and administering hypertonic saline cautiously. Let us take a moment to think about it. Now let's break down why this is the correct answer. In SIADH, fluid restriction is the first-line treatment. If sodium is dangerously low, hypertonic saline, 3%, may be used but must be administered slowly to avoid osmotic demyelination. Question 8. Which patient statement indicates a correct understanding of long-term corticosteroid therapy? A. I should take my corticosteroids with meals. B. I can stop taking my steroids when I feel better. C. I should avoid high potassium foods. D. I will increase my dose if I have swelling in my legs. Correct answer, A. I should take my corticosteroids with meals. Corticosteroids should be taken with food to prevent GI irritation. They should not be stopped abruptly, and doses should only be adjusted under a provider's guidance. Question 9. A nurse is reviewing the lab results of a patient with adrenal insufficiency, Addison's disease. Which findings should the nurse expect? A. Hyperkalemia and hyponatremia. B. Hyponatremia and hypokalemia. C. Hypoglycemia and metabolic alkalosis. D. Low calcium and high blood pressure. Correct answer, A. Hyperkalemia and hyponatremia. Addison's disease causes a lack of aldosterone, leading to sodium loss and potassium retention. A patient with type 1 diabetes mellitus is experiencing shakiness, sweating, and irritability. What should the nurse do first? Is it A. Administer insulin? B. Give a snack with protein and fat? C. Check blood glucose levels? Or D. Encourage fluid intake? The correct answer is C. Check blood glucose levels. Hypoglycemia symptoms must be confirmed with a blood glucose check before administering treatment. Last question. A nurse is caring for a patient who is post-adrenalectomy. Which intervention is the priority? Options are A. Monitoring for signs of infection. B. Encouraging early ambulation. C. Monitoring for signs of adrenal insufficiency. D. Administering IV potassium supplements. Correct answer C. Monitoring for signs of adrenal insufficiency. After adrenalectomy, the patient is at risk for acute adrenal insufficiency, which can cause hypertension, shock, and electrolyte imbalances. Great job working through these NCLEX-style questions. Keep practicing and you'll be ready for success. Don't forget to like, subscribe, and drop a comment below if you found this helpful. See you in the next video.